अरे यार फिर पिट गया। बिल देना। इसको आउटसाइड द ऑफ टाइम डालना चाहिए था। इसकी यही प्रॉब्लम है।
कब से?
जब से क्रिकेट खेल रहा है तभी से।
अरे भाई साहब, क्रिकेट की नहीं हो, आपकी खांसी की बात कर रहे हैं बुड़बक।
खांसी?
हाँ।
इसको तो 1 आध महीना हो गया।
खुद की खांसी को 1 आध महीने हो गए हैं और यहाँ क्रिकेट पर अपनी ही गुगली फेंक रहे हैं आप। चलिए चलिए चलिए।
डॉक्टर, खांसी तो है।
देखिए भाई साहब, इसे हल्का मत लीजिए। 2 हफ्ते से ज्यादा अगर आपको खांसी रहे तो टीबी हो सकता है।
टीबी?
हाँ, तुरंत डॉक्टर से मिलिए और बलगम की जांच कराइए।
ठीक है।
टीबी किसी को भी हो सकता है। अगर हो गया तो बिना भूले पूरा कोर्स करिए और फिट हो जाइए। नहीं किया तो इसका इलाज बहुत मुश्किल है। समझ गए भाई साहब आप? आइए। 2 हफ्ते से ज्यादा खांसी, तुरंत डॉक्टर से मिलिए और बलगम की जांच कराइए। टीबी हारेगा, देश जीतेगा।
India got freedom on August 15, 1947 from foreign rule, but still are struggling to breathe free because of TB, Mycobacterium tuberculosis. An estimated 40% of Indian population is infected with TB. Every year, 12 lakh Indians are identified with newly diagnosed TB. Only 58% are being diagnosed and rest are left undiagnosed or underdiagnosed. Over 10 lakh Indians with TB are not notified. 40% Indian children are currently underdiagnosed in India. TB has no age, no caste, no system. It can affect anyone at any time. It can affect any class of population, rich or poor. Myth: tuberculosis is hereditary. Fact: tuberculosis is not hereditary. The infection is transmitted from person to person through air. Myth: TB is easily contracted. Fact: TB is not easily contracted. Only close contacts for long time may increase the incidence of the disease. Myth: tuberculosis causes lung cancer. Fact: no. Tuberculosis can increase the risk of developing lung cancer. Myth: TB is caused by excessive smoking. Fact: no. Smokers are at risk to develop respiratory diseases. Myth: TB is a disease of the past. Fact: TB still continues to be a major problem worldwide. Myth: a positive tuberculin skin test, TST, indicates active TB. Fact: the tuberculin skin test only indicates whether the patient has been infected with a Mycobacterium strain. The test confirms only exposure to the disease, not the presence of disease. Myth: my TST, tuberculin skin test result was negative, so I do not have TB. Fact: this is not correct. More than 20% of people who are infected with TB do not have a positive reaction to the test. Myth: only persons with TB disease need antibiotics. Fact: TB is curable with medication and medical attention. If you have a latent TB infection, you should receive treatment to prevent you from getting sick in the future. Follow your doctor's instructions to ensure that it does not become harder to treat. Myth: only patients with active TB need anti-TB medication. Fact: even if tuberculosis tests are negative, the doctor may prescribe a course of preventive medication for 6 to 12 months. This will greatly lower the risk of later TB development. Tips to prevent tuberculosis. Avoid exposing yourself to people with active TB. Don't spend long periods of time with anyone who has an active TB infection. Know if you are at risk. Symptoms of TB can be persistent. Coughing for 3 or more weeks. Coughing up blood. Chest pain or pain with breathing or coughing. Unintentional weight loss. Fatigue. Fever. Night sweats. Chills. Lead a healthy lifestyle. People who are in poor health are more susceptible to the TB bacteria. Hence, it is important to do your best to lead a healthy lifestyle. Eat a healthy, balanced diet with plenty of fruit, vegetables. Exercise often, at least 3 to 4 times a week. Cut down on alcohol consumption and avoid smoking. Get plenty of good quality sleep hours at night. Maintain good personal hygiene and try to spend as much time as possible outdoors in the fresh air. Do a TB test if you have been exposed to someone with tuberculosis. If you have recently been exposed to someone with active TB, it is important to consult your healthcare provider immediately. How to avoid spreading TB? Stay at home. If you have TB, you need to take precautionary steps to avoid passing the disease to others. Ventilate the room. The TB bacteria spreads more easily in enclosed spaces with stagnant air. Therefore, you should open windows or doors to let fresh air in and contaminated air out. Cover your mouth. Cover your mouth whenever you have cough, sneeze, or even laugh. Wear a mask. If you are around people, it's a good idea to wear a surgical mask that covers your mouth and nose. This will help to lessen the risk of you passing the bacteria to someone else. Follow doctor advice and finish your course of medication. It is absolutely essential that you finish whatever course of medication your doctor prescribes. Failing to do so will lead to more serious condition like MDR-TB, which is more dangerous. MDR-TB is developed once you stop medicines in between, thus leading to drug resistance, which requires special care and differential treatment. Duration of treatment can go up to 12 to 20 months in case of MDR-TB. Finishing your course of medications is the safest option, not only for you, but for those around you. Now, you are safe in a help center. Here we take care of you to treat you and make you free from TB. On this World TB Day of March 24, get your own freedom from TB by visiting your doctor now. Only you can get your own freedom. The choice is yours. Leave the rest to the doctor. Issued in public interest by Cadila Pharmaceuticals. Makers of Rizorin, a novel formulation of boosted rifampicin, developed by joint scientific venture of CSIR Jammu and Cadila Pharmaceuticals Limited. Rizorin is also approved by DCGI.
ले जा रहे हैं ना तुम्हें पिक्चर, चलो बैठो बैठो। बढ़िया। फर्स्ट डे फर्स्ट शो। ऑनलाइन बुकिंग भी नहीं किया है, पूरे टाइम लाइन में धूप में खड़े थे। और पता कितना टाइम?
कितना टाइम?
अरे पूरे 2 घंटे।
अरे तुम्हारे टाइम के बारे में नहीं पूछ रहे हैं बुड़बक, इनके खांसी के बारे में पूछ रहा है।
खांसी ये तो 2 हफ्तों से हो रही है।
2 हफ्ते? पिक्चर ले जाते हैं फर्स्ट डे फर्स्ट शो और खांसी को हो गए 2 हफ्ते, ये तो बहुत केयरलेस है। चलिए हमारे साथ।
डॉक्टर? अरे आप तो बड़े सीरियस हो गए।
और नहीं तो क्या, 2 हफ्ते से ज्यादा अगर आपको खांसी होगा तो टीबी हो सकता है।
टीबी?
हाँ, तुरंत डॉक्टर से मिलिए और बलगम की जांच कराइए, क्योंकि टीबी जो है
वो किसी को भी हो सकता है।
और अगर हो गया तो बिना भूले पूरा कोर्स करिए और उसके बाद बेफिक्र हो जाइए। और नहीं किया ना तो इसका इलाज करना बहुत मुश्किल हो जाएगा मेरे हीरो हीरा लाल।
चलो।
2 हफ्तों से ज्यादा खांसी, तुरंत डॉक्टर से मिलिए और बलगम की जांच कराइए। टीबी हारेगा, देश जीतेगा।